This is the Daily Medical News by MD Edge, where we bring you the top stories in clinical medicine, followed by a deeper dive into the day's top story. Today is Monday, October 21st. I'm the voice of MD Edge Podcasts, Nick Andrews. Remember, if you want to learn more about any of these stories, you can find links to the source in the podcast notes. Coming up later, one physician says it's not the flavors of vape that need to be regulated, it's the nicotine. But before we get to the news, a quick look at what's going on this week at MD Edge Podcasts. The Post Call Podcast, which is a show that I host alongside Dr. Emi Okamoto, all about the life and times of being in healthcare, with new episodes dropping every Friday. This past episode included topics like how to reduce phone calls in your practice and if and when to charge your friends for medical advice. You can find the Post Call Podcast wherever you listen to podcasts. And now, the top headlines in medicine. We begin today with an update on the global blood supply. Nearly 2/3 of countries have an insufficient supply of blood for transfusion. This is according to a recent modeling study that included 195 countries and territories. Not one country in Oceania, South Asia, as well as Eastern, Central, and Western Sub-Saharan Africa had enough blood to meet estimated needs. Researchers also found that low and middle-income countries were the most often affected. Shortages were attributable to a variety of challenges, including resource constraints, insufficient component production, and a high prevalence of infectious diseases. The investigators also suggested that existing guidelines may need to be revised. Those guidelines call for 10 to 20 donations per 1,000 people in the population. Denmark had the greatest supply of blood products, which include red blood cell products, platelets, and plasma, at nearly 15,000 units per 100,000 population. South Sudan was the least prepared to meet transfusion needs with just 46 units per 100,000 population. To meet demand, some of the most affected countries would need to raise their collection goals from single-digit figures to as high as 40 donations per 1,000 population. And obesity increases risk for type 2 diabetes more than lifestyle or genetics. This is according to data from a Danish population-based case cohort study that was presented at the 2019 annual meeting of the European Association for the Study of Diabetes in Barcelona. In the study, researchers examined more than 9,500 participants in the Diet, Cancer, and Health cohort, which is a large prospective study that has been running for nearly 30 years. They report that having a BMI of more than 30 was linked with a 480% increased risk incident type 2 diabetes compared with BMI between 18 and 25. Furthermore, the researchers found that BMI between 25 and 30 carried a 100% increased risk of type 2 diabetes. The researchers also reported that having an unfavorable lifestyle increased the risk of diabetes by 18%. They defined unfavorable lifestyle as having either 0 or 1 healthy lifestyle characteristics, such as smoking status, moderating alcohol consumption, exercise, and eating a well-balanced diet. Considering individuals' genetic risk score and lifestyle score together showed an increasing risk of developing type 2 diabetes as well. And the guidelines for treating community-acquired pneumonia have been updated in the American Journal of Respiratory and Critical Care Medicine. The update to the 2007 guidelines was published by 2 medical societies and was based on the work of a multidisciplinary panel that conducted pragmatic, systemic reviews of the relevant research and applied grading of recommendations, assessment, development, and evaluation methodology for clinical recommendations. The 2019 guidelines will have the following key recommendations that differ from the previous guidelines. 1. Sputum and blood culture samples are recommended in patients with severe disease, as well as in all patients empirically treated for MRSA or Pseudomonas. 2. Macrolide monotherapy is only conditionally recommended for outpatients based on resistance levels. 3. Procalcitonin assessment, not covered in the 2007 guidelines, is not recommended in order to determine initial antibiotic therapy. 4. Corticosteroid use is not recommended, though it may be considered in patients with refractory septic shock. 5. The use of healthcare-associated pneumonia as a category should be dropped, with a switch to an emphasis on local epidemiology and validated risk factors to determine if the need for MRSA or Pseudomonas treatment. 6. Standard empiric therapy for severe community-acquired pneumonia should be beta-lactam macrolide and beta-lactam fluoroquinolone combinations, but with stronger evidence in favor of the beta-lactam macrolide combination. The updated guidelines also include a number of other recommendations, such as dealing with the management of patients with comorbidities. Welcome back to the Daily Medical News. I'm Nick Andrews. The number of vaping-associated lung injury cases reached 1,479 at the time of this recording, according to the most recent data provided by the CDC. There have also been 33 deaths. The injury, now called EVALI, has occurred in all U.S. states except Alaska, as well as in the District of Columbia and the U.S. Virgin Islands. 70% of patients are male, 79% are under the age of 35 years. Information on the substances used over the previous 3 months before symptom onset was available for 849 patients and included the following. 78% reported using THC-containing products with or without nicotine-containing products. 31% reported exclusive use of THC-containing products. 58% reported using nicotine-containing products with or without THC-containing products. 10% reported exclusive use of nicotine-containing products. The CDC is now doing additional testing on available samples for chemicals in the bronchoalveolar lavage fluid, blood, or urine. They are also performing lung biopsy or autopsy specimens. CDC is also validating methods for aerosol emissions testing of case-associated product samples from vaping products and e-liquids. In a related development, Juul, maker of e-cigarette products, has announced that it will suspend the sale of non-tobacco, non-menthol flavors in the U.S., pending review by the FDA. The Juul announcement comes in advance of an expected FDA ban on flavored e-cigarettes. And finally today, our coverage of the U.S. vaping situation continues. While most of the recent legislative action on e-cigarettes and other electronic nicotine delivery systems are focusing on the flavors that are appealing, especially to children, one doctor came before a House subcommittee to testify that regulators should be targeting the nicotine content instead of the flavor. Dr. Michael B. Siegel is a physician and professor at Boston University School of Public Health. He said that the turning point in the spike of youth e-cigarettes occurred when products like Juul, Sorin, Smoke, and Fix were introduced. He pointed to evidence that in 2014, the National Youth Tobacco Survey from the CDC, that 74% of non-smoking e-cigarette users reported using e-cigarettes no more than once per week, and only 4% reported daily use. By 2018, 12% reported daily use, and 42% reported that they used it only once a week. Dr. Siegel reported that these new brands use a different nicotine formulation that is virtually different from all other e-cigarette brands, saying that they use nicotine salt at very high concentrations. He said that using nicotine salts allows nicotine to be absorbed into the bloodstream much quicker, which simulates the pattern you get with a real cigarette. Dr. Susan Tansky is a pediatrician at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. She also testified. She testified on behalf of the American Academy of Pediatrics, agreeing with Dr. Siegel that the FDA needs to be doing more to regulate the amount of nicotine that these products are releasing. She also agrees that the introduction of nicotine salt was a significant cause of addiction. However, she also added that flavors are a key issue. She said that we know that flavors unto themselves are pleasurable. If one links a pleasurable flavor with a buzz of nicotine from a powerful nicotine delivery system, it's even more behaviorally and biologically reinforcing to drive addictiveness. The subcommittee hearing was held to solicit opinions on H.R. 2339, which is called the Reversing the Youth Tobacco Epidemic Act of 2019. Among the provisions in the bill are raising the minimum age of purchasing all tobacco and nicotine products to 21 years, requiring healthcare warnings on e-cigarette products, and placing restrictions on advertising that are similar to those on smoking products, as well as prohibiting internet sales of e-cigarettes. You can read more about the testimony of Dr. Siegel and Dr. Tansky by clicking the link in the podcast notes. And that's it for today's edition of the Daily Medical News. Don't forget, as always, you can find more from these stories in the podcast notes. For MD Edge, I'm Nick Andrews.